In Utah, over 3.7% of adults identify as LGBT. This means out of the 2 million Utah adults, 80,000 are LGBT. Additionally, many of these adults are millennials or Gen Z, as 40% of the LGBT Utah adults are under 25 years old. The LGBTQ+ community experiences many unique health challenges. However, I will be focusing on the challenges most relevant to the Utah LGBTQ+ youth, young adults, and members of the Church of Jesus Christ. For now, I'll set aside vulnerabilities associated with drug and alcohol use or sexual relations. First is stress. LGBTQ+ youth and adults report experiencing higher average stress levels than those who are not LGBTQ+. One reason for this is minority stress, which is a type of chronic stress individuals may face due to internalized fears relating to their sexuality, gender identity, or other factors. Next is mental health. LGBTQ+ individuals are more likely to experience struggles with mental health. A 2019 Sharp survey of Utah youth showed that LGBTQ+ youth in Utah are 2 to 4 times more likely than their cisgender heterosexual peers to consider, plan, and attempt suicide. Transgender youth are most at risk, as 59.7% answered that they had seriously considered attempting suicide in the past 12 months. Additionally, 47.5% answered that they had made a plan, and 31.8% answered that they had attempted suicide one or more times in the past 12 months. Another problem LGBTQ+ people experience is harassment. In a 2017 Harvard poll, over 50% of respondents answered that they, or someone LGBTQ+ they know, have experienced each of the following things: anti-LGBTQ+ slurs, derogatory comments, threats, sexual harassment, and violence. Similar negative experiences extend into healthcare, as 16% of LGBTQ+ individuals reported on experiencing healthcare discrimination because of their sexuality or gender identity. Such experiences include the provider using harsh language, being physically abusive, and refusing the patient needed care. Healthcare discrimination contributes to healthcare avoidance. The same Harvard poll showed that 18% of LGBTQ+ participants have avoided seeking care due to fear of discrimination or mistreatment. So, the question now is, what can providers do to better serve the LGBTQ+ population? The answer is to create inclusive and LGBTQ affirming spaces in healthcare. But how is this done? Luckily for us, the National LGBTQA+ Health Education Center provides 10 strategies for creating inclusive healthcare environments for LGBTQA+ people. First, actively engage leadership. Healthcare organizations should actively involve the governing board and senior management in health center-wide commitments to change. Often this will include having at least one member of the senior management who is highly dedicated to the LGBTQA+ inclusion to champion the effort. Second, organizational policies should protect LGBTQA+ people. Policies such as non-discrimination policies, restroom policies, family and support person policies should be in place, examined, and/or adjusted to ensure that they are inclusive and protective of LGBTQA+ people and their experiences. Third, the physical and virtual environment should welcome LGBTQA+ people. LGBTQA+ patients look for signs inside facilities and amongst websites and social media to see if an organization is LGBTQA+ friendly. Providers should evaluate if the images and resources they provide include the LGBTQA+ community. Fourth, forms should reflect LGBTQA+ people and their relationships. The language used on health forms is an important indicator if a provider is LGBTQA+ inclusive. Gender-inclusive response items such as spouse or partner instead of wife or husband should be used along with other inclusive language. Fifth, providers should build partnerships with the LGBTQA+ community. This means engaging and becoming involved with the LGBTQA+ community. Join in events and efforts to promote collaboration and inclusion to show that the organization is aware and dedicated to caring for the LGBTQA+ community. Sixth, all staff should receive training on affirming communication and care. Clinical and non-clinical staff who may interact with patients should be trained on LGBTQA+ health disparities and affirming communication. Using correct language is key for building trust and for building confidence amongst providers. 7th, sexual orientation and gender identity data should be collected and used to improve health outcomes. To evaluate and improve care of LGBTQIA+ patients, sexual orientation and gender identity (SOGI) questions can be included on registration forms and in electronic health records. 8th, all patients should receive routine and inclusive sexual health histories. Adolescent and adult patients should be routinely asked about their sexual health. Inclusive questions such as, "Are you in a relationship?" and "What are the gender or genders of your sexual partners?" should be asked. 9th, clinical care and services should meet LGBTQIA+ health care needs. In addition to the care generally needed by all patients, LGBTQIA+ populations often have specific and unique healthcare needs. Gender-affirming care, behavioral health care, prevention and screening, and other services may be needed. 10th, LGBTQIA+ people should be recruited and retained. To improve LGBTQIA+ health competency and proficiency, individuals interested and knowledgeable in this area should be added to the workforce. Once hired, the workplace environment and programs should promote equity in order to encourage retention. By taking these steps to create inclusive and affirming spaces, the LGBTQIA+ population will receive better care for their health needs. LGBTQ+ affirming spaces have been shown to decrease LGBTQ+ youth suicide attempts by 3 to 9%. By recognizing needs and making changes, we can better serve everyone around us.